Renal artery stenosis. Renal artery stenosis is the narrowing of the renal artery, most often caused by atherosclerosis or fibromuscular dysplasia. In this video, we see the two kidneys and our artery and the renal artery with the stenosis in the proximal part. This narrowing of the renal artery can impede blood flow to the target kidney. Hypertension and atrophy of the affected kidney may result from the renal artery stenosis, ultimately leading to the renal failure if not treated. In this video we see the physiology of the renal artery and the blood in the in this radiology color red. The same signs and symptoms. Most cases of the renal artery stenosis are asymptomatic, and the main problem is high blood pressure that cannot be controlled with medication. Deterioration in renal function may develop if both kidneys are poorly supplemented or when treatment with an ACE inhibitor is initiated. Some patients present with episodes of flash pulmonary edema, sudden left ventricular heart failure. In this video we see the renal circulation. Abdominal arc, vein cava, two kidneys, and the vein and artery renal. With a renal artery stenosis, the narrowing of the renal artery can be give all blood to the kidneys and start the renal disease. Etiology. Atherosclerosis is the predominant cause of renal artery stenosis in the majority of patients, usually those with a sudden onset of hypertension as age 50 or older. Fibromuscular dysplasia is the predominant cause of the young patients, usually females under 40 years of age. A variety of other causes exists. These included arteritis, renal artery aneurysm, extrinsic compressions with neoplasms, for example, neurofibromatosis, and fibrous veins. Physiopathology. The granular cells of the afferent arteriole sends a decreased systemic blood pressure owing to the reduced blood flow through the narrowed artery. The response of the kidney to the perceived decreased blood pressure is activation of the renin-angiotensin aldosterone system, which normally counteracts low blood pressures, but in this case leads to the hypertension. If the stenosis of long-standing and severe, the glomerular filtration in the affected kidneys never increase again, and renal failure is a result. This doctor talk about the renal artery disease and failure renal. We see the renal artery and kidney, and we see in the proximal part of the artery the stenosis with a principal cause, the atherosclerosis. The treatment is initially treated with medication. There include statins, antiplatelet agents, and route of control of the blood pressure. When high-grade renal artery stenosis is documented and blood pressure cannot be controlled with medication, or if renal function deteriorates, invasive products may be resorted to. The most commonly used invasive producer is angioplasty with or without standing. Thanks.